Hi dear students, in this special series on subject-wise strategy, we are going to identify all the important topics that you must keep in mind before you start working on a subject. We'll be looking at the trend for each subject and then mapping it to all the tasks in the app so that you can prepare better and score better. In this video, we'll be discussing the strategy for preparing orthodontics. Now, ortho is quite an important subject because the weightage is nearly 14 questions for each exam. And over the past few years, they have maintained this weightage quite seriously, as you can see, from 14 to 20 questions sometimes too. Now, the variation in these weightage in the trend, it could be because there's a lot of overlap of ortho with pediatric dentistry in terms of appliances, in oral habits, preventive and interceptive orthodontics, development of dentition. So these are some topics which correlate very well with periodontics, and that's why there is a variation in the weightage. So now what we'll do is we'll look at the questions from previous NEET MDS exams, as you can see on the right side, and there are topics which we will assign to each of these questions, which you can see on the left side. Now with this, we will be able to understand which topics are more important or rather more popular in the previous NEET MDS exam, and that will help us understand what should be your topic of interest, what should be your areas of concern or focus when you are preparing for ortho. So let's look at the first question. Which of the following appliances would be recommended in a mixed dentition with bilateral loss of primary mandibular molars? And this is on space maintainers. That's preventive and interceptive orthodontics. Crystal growth is related to bonding of brackets. So that's fixed appliances. Mini aesthetics is a part of soft tissue aesthetics. Next question. 5-year-old showing spacing and what will be the management? So this is based on treatment plan. Then this question is on obstructive sleep apnea. Then we have spheno-occipital synchondrosis, which is growth. Then growth pattern for maxilla versus mandible. Input and output all seen in servo system theory. So theories of growth. The consequence of torquing would lead to labial inclination of root, biomechanics. Then we have a question on lingual arch soldered bands to molars. They are fixed non-functional appliances. Again, preventive and interceptive. Then this is a radiograph of distal shoe, preventive and interceptive. Then we have surgical orthodontics, corticotomy, which accelerates orthodontic treatment. Then there is a question on golden proportion as to what should be the length of the tooth in picture. So that's model analysis. Then a clinical picture of adenoid faces that corresponds to etiology of malocclusion. Then a choice of retainer in given case, fixed retainer. This is a typical cephalocaudal gradient of growth. Then we have a class 3 image, so treatment planning. Right, then we have an image of the buccal corridor, which is soft tissue analysis. And this is a question on biomechanics, where the amount of force is given and you have to calculate the moment of force. And this is the explanation. Here is the key concept. Key concepts are more concise. Explanation will give you all the details with the illustrations. Then we have a question on a 7-year-old child, which is a mixed dentition analysis, so Hakaba analysis. Then index of orthodontic treatment needs. Then you have a cephalogram and you have to determine what kind of malocclusion is seen. So this is a question from cephalometric analysis. Then another question on etiology of these winged incisors given in the image. So that's etiology of malocclusion. And the next question is on treatment plan. What is going to complicate the treatment plan? Then we have an image-based question on K-loop, which is on fixed appliance. Then dental compensation, which is a part of treatment plan for class 3. And here you have elastics for midline correction. So that's fixed appliance. Then which movement is depicted in the image? Now again, you can also look at the explanation. Don't forget to check out the video explanations for a more in-depth understanding of the topic. Right, so this is from biomechanics. Then we have skeletal class 3 malocclusion. Then we have a removable appliance identification of pendulum appliance. And a straightforward question on corrective orthodontics. Milwaukee braces cause class 2 malocclusion, that's etiology. Then an application based question of face mask, that's orthopedic appliance. Then we have a treatment plan question on removable appliance. And a clinical image, illustration of Herbst appliance, which is a myofunctional appliance. And this is a repeat question. We've come across this question again. This was asked in NEET 2022 and now again in 21. Biomechanics. Then a patient was treated orthodontically for midline diastema. The best way to prevent relapse would be fixed lingual bonded retainer. So that's a fixed appliance. Then a 5-year-old patient is showing generalized spacing. Again, this question is repeating. So you will see a lot of these questions repeat from time to time. Straightforward questions, clinical questions. Keep them in mind. 7-year-old child presents with bilaterally missing molars. This is also a repeat question. Lingual arch from preventive and interceptive. Right, then you have brackets, which are auxiliary force delivery used in fixed appliance. Then retainer of choice for midline diastema would be a fixed lingual retainer. Then which space maintainer should be given in the clinical situation? This is a growing patient with development of dentition going on, so no space maintainer, preventive and interceptive. 8-year-old patient comes to you with malocclusion. You are going to wait and watch. This is development of dentition. 8-year-old with a supernumerary tooth comes to you, then you will extract. This is again development of dentition, also treatment plan question. Then a 60-year-old obese comes during daytime complaining of all these problems. This is because of obstructive sleep apnea. Then you have an image-based question of Frankel 2, myofunctional appliance. Then you have an image-based question of second order bends from fixed appliances. Then a question on theorems of retention, straightforward factual question. Right? Then you have SNA, SNB values given and what kind of treatment of choice would you give to this patient. So here is reverse pull headgear, so orthopedic appliance. Which of these appliances uses delta clasp, twin block, myofunctional appliance? 7-year-old patient with premature loss of mandible of maxillary molar. Here distalization can be done with Lucia jig. So that's preventive interceptive. Then in this image, patient has angles class 1 molar relation. Identify the subtype. So case based of types of malocclusion, classification of malocclusion. Then identify Herbst appliance, again a repeat question from myofunctional. Then a 12-year-old with class 2 malocclusion, deep bite and retruded mandible. you will give a functional appliance because it's a growing patient, so myofunctional. 8-year-old with frenal attachment, you will wait till the canines to erupt, so that's related to etiology and treatment plan. Then again, obese patient with obstructive sleep apnea, repeat question. This is a cleft palate question. First time, cleft palate repair and secondary alveolar bone grafting, everything is important with regards to cleft palate. Distal shoe space maintainer, specifications have to be remembered, preventive and interceptive. Anchorage, first question from anchorage, right? So that goes to biomechanics. Then Wilcodontics is surgical orthodontics, accelerates orthodontic tooth movement. Angle of insertion of mini implant, factual question. Pre-surgical nasoalveolar molding, you must know this in appropriate detail. Cleft lip and palate repair. Pericision with regards to retention, that's CSF. Supracrestal fibrotomy, surgical. Couple of forces are equal and opposite forces, that's biomechanics. This is a spot welder. And this is a tongue crib. Then we have a question on inability to produce bilabial sounds with regards to a specific malocclusion. So that's etiology of malocclusion. Then a straightforward question on definition of interceptive orthodontics. Then intramatrix rotation of maxilla and mandible growth. Components of IOTN, the index. Secondary and intermediate alveolar bone grafting, again cleft palate repair. Force applied by jack screw in RME, that's removable appliance. Reapproximation procedures in orthodontics is related to gaining space, that's preventive and interceptive. Safety valve mechanism for pubertal growth, growth of maxilla. Values for incisal liability, development of dentition. Repeat question of a spot welder image. Then obstructive sleep apnea, definition. Which of the following is not an absolute indication of study models, mounted study models? So that's from model analysis. Favorable for reinforcement of anchorage, tooth with good proximal contacts. Then center of resistance, center of rotation, and the kind of movement that they will cause, biomechanics. Method to retain corrected maxillary canine rotation is CSF. Then Kessling's diagnostic setup, model analysis. And the best time to modify growth with myofunctional appliances, late mixed dentition. W-arch appliance. Diagnostic aid for measuring transverse discrepancy. So this is cephalometric analysis. CAT's classification is based on premolars, right? So you can go through the explanation here and watch the video. Then plane of reference used in widths analysis. This is again cephalometric analysis, functional occlusal plane. Then question on model analysis, Tanaka Johnston uses which of these teeth? So it uses mandibular incisors. And lastly, which of these is the most promising soft tissue investigation? So that's a soft tissue analysis question, right? Now, based on this activity, what are the outcomes? So we realize that we have a lot of questions from preventive and interceptive orthodontics, fixed appliances and model analysis, followed by all the appliances, growth and orthopedic appliances. So this gives us a fair idea as to what should be your focus area when you are preparing for orthodontics. Now, the questions, lesser questions from topics towards the end does not mean that they are not important. but you must certainly focus more on these topics which have more number of recall questions. Now, once you have identified these focus areas and topics, how do you apply that in the app? So in the app, you will have task modules under the guided prep option where you have all these topics as individual tasks, right? To be able to prepare and practice your questions. So suppose if you want to prepare, say, growth in ortho, the first thing would be you click on the prepare button here and go through all the topics, right? And then whichever topic you want to prepare, just press on view workbook or view video and you will be able to access all this information which is more concise, organized in flowcharts and tables and easy to remember. You can also watch the video here for each topic. And once you've prepared the task in detail, you can either practice questions or take test and continue to do so for all the tasks. And now I will tell you how to maximize your preparation with Meritor's app. Now there are 5 things to keep in mind when you start your preparation for any subject at any given point of time. Number 1 is to start with tasks. Like I said, tasks are the building blocks. They are your foundation and fundamental for any subject. You need to start preparing for the task with the workbook. You must look at the video if you have any doubts regarding the topic and then practice questions. And then you can take the test. Now, whenever you are taking a test or practicing questions, each question comes with the answer, explanation and key concept. The explanation will be elaborate. It will tell you everything that you need to know about the topic. It is a good source of taking down notes because a lot of additional questions can be asked from the existing explanations, right? And if you are well versed with the topic, you can just look at the key concept and reinforce the topic in your mind. Additionally, a lot of questions also come with multiple choice question videos, which are explanatory videos. They are going to talk about how to eliminate options, how to strategically focus on the question, and additional knowledge that comes with the topic. So your first aim should be to complete all these tasks for a given subject and then move on to the next thing, that is Q bank. Now Q bank or question bank is a collection of high yield extensive questions. They are clubbed together in topics. They are clubbed together chapter wise and you will have more hands-on experience on difficult and extensive preparation on these questions. Again, they will come with explanatory videos, explanations and key concepts. So once your tasks and Q bank for a given subject are complete, you are good to appear for the weekly checkpoint tests. Now the tests are of 2 types in the app. One is the weekly checkpoint test and self-paced test. I'll tell you about the weekly checkpoint test first. So suppose if you are preparing one subject over the week, then at the end of the week you will have a test which is going to focus on that specific subject plus the subjects that were previously prepared, right? So that kind of snowballs the entire revision strategy. You will have a repeated encounter of multiple subjects from time to time. So you do not forget. It's easier to keep these topics in mind when you constantly see them. So the revision is reinforced. Plus you also get personalized AI recommendations, right? So at the end of your test, based on your performance, you will get how many questions you answered, what was the score, how much was the negative marking, where are you lacking, what are your stronger points, and then it will tell you how much time to dedicate for a revision of your weaker subjects. So with this strategy, you will be able to focus on specific areas that are your weaknesses. Now that is an exceptional feature of Meritor's app. And the next set of tests is self-paced test, which you can take at any given point of time. These are subject-wise tests. You can also have cumulative tests, multiple recall questions also incorporated in form of tests. And towards the end of your preparation phase, you will have a lot of volatile, factual, high-yield questions in form of final strokes, which are again specialized tests to be able to remember these topics clearly before the exam. Now, once you come closer towards the end of your preparation, you will have access to this special feature of the app called Marathon. This is activated towards the end of your preparation, where you will have 3,500 plus high yield questions. High yield questions meaning they have the chances to be seen in the exam, because either they are based on recall questions or because they are based on important concepts that are repeatedly seen in the exam. So when you practice these 3,500 plus questions, You will also enter an all India competition where you will get a fair idea as to how your performance is with comparison to your colleagues. It's a great boost of confidence if you take it at the right time. And lastly, we have the all famous national mocks, which is a pan India or all India nationwide simulation of NEET MDS exam. We conduct them towards the end of your preparation in a few months to go. And every weekend you will have access to this special test. You will see a lot of new questions in national mocks which are based on important topics. So do not miss national mocks because it gives you a good hands-on experience of the exam. It gives you an idea of time management because this is exactly according to NEET pattern, that is 240 questions and 3 hours with negative marking. So you kind of get a very fair and square idea of your performance because this is again an all India competitive mock exam, and you will get personalized AI recommendations here as well. Now they are more important for national mocks too because towards the end when you are revising, you will not know which subject to pick up at what time, and your performance in the national mock will be assessed thoroughly and you will get your AI recommendations which will tell you which subjects to revise. So make sure that you are making use of all of these features in the app. Now apart from that, if there is any query that you have while solving your questions, if you have any doubts regarding any topics, you can always contact the faculty on the WhatsApp group. We are always here to help you. And I hope with this in mind, you will be able to channelize all your preparation strategy in the right direction. And I hope we'll be able to help you achieve your dream seat in MDS. Thank you so much and good luck from Team Meritors.